Welcome to this edition of Pulse on Health. I'm your host, Mark LeMay. It's another week and another set of rules and guidance when it comes to the COVID-19 pandemic. Joining us on this edition of Pulse on Health, Dr. Zandra Kelley, Chief Medical Officer of Greater Lawrence Family Health Center. Welcome back, Doc.
Thank you.
Can you explain in the simplest terms possible what the CDC came out with for recommendations last week?
Sure thing. So for booster shots in particular, it sounds like they are recommending it for any of the previous vaccines given, whether it be Pfizer, Moderna, or J&J. For the Pfizer and Moderna vaccines, the recommendation is 65 or older to get a booster for sure. And then there are certain categories for people who are 18 and older. And those are basically people who work or live in settings that have a lot of people or a lot of expectation of people potentially having COVID, such as healthcare workers and people who live in long-term care facilities with a lot of other people, and also people who have underlying medical conditions. So that is the same list of underlying medical conditions that put people at high risk for COVID. So that is the basic underlying who gets it. And then they recommend it after 6 months after the last dose that was given. And for J&J, I believe it's 2 months after because it was just a one dose. So it's 2 months after that dose. The other thing too that I'm sure is raising a lot of questions is the whole mix and match question. And basically, my take on that is that it is safe if you get one vaccine from a manufacturer to then have a booster from a different manufacturer. They do not yet say that they recommend specifically to mix and match, but that it is safe to do so. And I think there is some data out there that shows that it may be better to mix and match, but they have not come out and said yet that it would be better, only that you can do it. And I think because there just isn't enough information yet to show whether it is or isn't actually recommended to do the mix and match versus getting the same. And I think part of that is because each of the vaccines is so different. With the Pfizer vaccine, there was a 3-week in between doses. With the Moderna, there was a 4-week in between doses. It's hard to say whether the differences that you see in the effectiveness is because there was a shorter or longer time interval between the doses originally. And so it's hard to say whether the benefit from getting that booster is actually due to it being a different vaccine, or if you got the same vaccine, if it would show the same effectiveness.
So I'm gonna put on my MD hat for a minute, which I don't have one, but I got the Moderna vaccine. I'm personally gonna edge for getting the Moderna follow-up.
Yep.
That's okay.
Absolutely.
But it's also okay if my employer doesn't have Moderna and I get the Pfizer.
Exactly.
Am I correct?
Yep, that is correct.
Okay. And I guess there's a fine line between recommendation and yeah, it's okay because we don't have any bad information on the mix and match versus again, like I said, like a recommendation of yes or no. Am I correct?
Yes. So exactly. So there's a difference between safety. So clearly it's safe. The vaccines are all safe. And so you can get a dose from a different manufacturer. On the other hand, whether is it better or is it not better, the jury's still out on that as to whether they would recommend, oh yeah, definitely you should, versus if you do, it's totally safe and you will still get the boost either way.
Do you think the medical community and more specifically the CDC is feeling some sort of pressure, whether it be political pressure, whether it be societal pressure, to make, I don't want to say hasty decisions, but decisions that might not seem appropriate, I guess.
My sense is that the decision-making is more related to all the people dying of the pandemic, right?
Okay.
So the desire is to not wait too long. In the past, the way decisions were made took months or years, not because there wasn't any information available, but because, things took a long time. People had to have meetings, sit down, but now because there's so much concern, of course, about COVID and the pandemic and how many people have been dying from it, that it is still, we are still going through waves in the United States, and we don't know if there's another one coming. I think there's really the desire to protect as quickly and as much as possible. And as long as we know that things are safe, then, which we do know, I mean, millions upon millions upon millions of people have received these vaccines. So I think there is more data than we may ever have for anything else.
Right.
And so I think the safety part is very clear. And then the question is, how often and, how much benefit do we get? And those things, definitely, we will get more information with time. But the safety is there, and definitely with the third dose, there is a boost in efficacy. So we don't want to hold that from people when there's still a pandemic going on, and we don't know if there's another wave coming.
What about the kids, 5+? What is there anything coming down the pipe on that?
Yes, there are meetings coming up this week and next regarding kids. So I hope that there will be a decision within the next couple of weeks. Of course, you can't know until it's actually done, but I certainly expect that they will be looking at all that data and coming up with a decision soon.
And again, what we're talking about from last week was a booster, not a third dose. Am I correct?
Yes. So the third dose was already approved months ago for the Moderna and Pfizer for people who had immunocompromised or any conditions that would cause their immune system to maybe not respond 100% for the first 2 doses. And the same thing is common as people probably know for lots of vaccines. For hepatitis B, people usually get 3 doses over a period of time. And that's because after the first dose, maybe 50% of people will respond. Second dose, maybe up to 80%. Third dose, maybe above 90%. So we really hope to get the most benefit possible for the most people. And for those who are immunocompromised, their immune systems may not really react as strongly to the first dose or second dose. The third dose does really seem to get more people into the protected range. So that's why for those who are immunocompromised, there was actually a third dose in their series. But that's different from a booster for people who've already completed their series and then 6 months later could get a booster.
So I'm a middle-aged male, no immunocompromised setting. I'm getting a booster. And if I were immunocompromised in some sort of way, that would be a third dose.
If you were immunocompromised, you would get a third dose, which was already approved, some time ago. Then potentially the immunocompromised person would get a booster 6 months after their third dose.
Okay. So this vaccination situation is long-term.
Yeah, I mean, I do think that what we are seeing is that the virus certainly is not going away quickly. There seems to be a lot of it just continuing to spread amongst any population. Certainly, the goal of the vaccine, which has been very effective, is to decrease death and decrease hospitalization and severe disease, and hopefully decrease risk of long COVID. So, all of those are certainly happening. And just like with the flu, I think sometimes maybe people forget that people do die of the flu every year. And we have had massive extreme pandemics in the past of flu. And that's why we have flu vaccine. Now, flu is very different from COVID in that it changes very rapidly. The type of or the sequence of the virus, the code of the virus changes very rapidly for flu. So every year we get a new vaccine because the virus looks a little different every year. Now, COVID does not seem to change quite as rapidly. I think we're seeing the changes rapidly now because so many people are infected. So there's so much chance for the virus to replicate that we're seeing lots of changes. But if we get to the point where not as many people have COVID, then hopefully the changes to the virus will be much slower.
Well, you mentioned the flu season. Flu season is upon us.
Mm-hmm.
Any recommendations for people when it comes to getting the COVID booster and the flu shot? For example, not getting them both together, maybe?
Yeah. Well, I'll just admit I got mine on the same day. One in each arm.
Okay.
And it worked out fine. I think it very much depends on each person. If they know that they've had reactions in the past to either one, maybe that's a good idea to get them separately. Or if they just want to get them all over with at the same time, that would be fine too. It's certainly considered to be safe to get them both at the same time.
Mm-hmm.
And I think one of the reasons there was some distance between the shots in the past was so that we could really get some good data and know what was a response to the COVID shot versus what was a response to the flu shot. But now that we have really good data on COVID vaccination and we know that it's safe, getting them at the same time is not something that people have to avoid, and separating them is not required.
You are the chief medical officer, but you're also a practicing physician.
Yes.
Do you see hesitancy when it comes to getting flu shots this season, maybe as a result of COVID?
It's been very interesting. I really have not personally found any more hesitancy than usual. And I actually have had a lot of people coming in specifically asking for the flu vaccine. So that may just be my particular practice and what I've seen, but I feel like I've seen more people coming in asking for the flu vaccine than I have in the past. Now, the same people who preferred not to get a flu vaccine in the past are maybe debating a little bit more this time. But I definitely see, it seems to me, and of course I'd wait and see what the numbers are in terms of people who've gotten the flu vaccine, but I certainly did not notice any more hesitancy than usual.
I might be putting the cart before the horse with this question, but do you see a point where maybe the two, COVID and the flu shot, could be combined?
We certainly could see that in the future. Just like just recently, a new combination of pediatric vaccines came out. You know, anytime you can give people one shot instead of two, they really like that and prefer it. So I'm sure it could be possible. The one thing that really goes against it, though, I think, is that we do have a different strain of flu every single year. So it's hard to know whether, as they produce flu shots, if the COVID vaccine, which may not be changing, would be as frequent, you know, as the flu shots are.
I'm going to ask you to pull out your crystal ball along with your stethoscope on this one. Will we always have to get a COVID booster, or is this something we're in a wait and see pattern on?
I think we're still in wait and see. You know, there are definitely some vaccinations where we do get boosters. As people know, tetanus, you know, if you get a cut, you know, in your foot, let's say you go to the emergency room, they'll give you a tetanus booster. So, and pertussis, we're doing boosters right now as well. So, and those are every 10 years. So it's always hard to tell. Every type of infectious agent is different. And COVID certainly has some similarities to flu, for example, but there are also a lot of differences. So it's pretty hard to tell at this point whether this third dose that we're getting, this booster, and then what will come after that, if it will really help us to get any more lasting immunity, or whether we will then require another booster. It's really hard to tell, I think, at this point.
And last but not least, because this is an important question, how is the Merrimack Valley faring when it comes to COVID?
Yeah, that's a really good question. I think overall, we have good vaccination rates. We certainly hope to keep raising those vaccination rates. But we're definitely seeing that we have a good number of people vaccinated. So while we did have an increase in hospitalizations in the last, a month or two ago, that is definitely coming down now. And of course, a lot of the people who were in the hospital or passed from COVID were people who were unvaccinated, unfortunately. I think right now we're seeing it come down a bit. So it's still at a level that is considered to be high transmission, but it's certainly not as bad as it was a month ago. So we just hope that we continue to see that trend decrease. If we look at the United Kingdom, for example, they started with the Delta virus before us, about a month or two. And then we followed a very similar pattern as them once Delta came to the United States. They are now seeing another uptick. So it's hard to know whether we will mirror that kind of thing. The rest of Europe, I think, has not been so far, or if we'll be able to sort of remain where we are and then go down. So I think it's been improving, but I wouldn't feel too hunky-dory about that yet. And I think part of it is the masking and the distancing that people do when the rates go up. And I think the UK had relaxed a lot of that and people were out more, and then they saw the numbers go right back up again. So there's so many factors, and I keep talking about there's so many layers of the protection. And if we can try to, do the best we can to do all of the layers, hopefully we can protect each other to a really high degree.
And unfortunately, I'm going to put you on the spot with one more question.
Okay.
The holidays.
Yes.
What advice can you give people for Thanksgiving dinner, Christmas dinner, holiday gatherings? And again, I'm putting you on the spot with this one, Doc, but
yeah,
what's your advice?
So I think my number one advice is to become vaccinated and to have everyone who's there be vaccinated. And hopefully by then we will have the vaccine available for children 5 and up. And so even some of the children will be able to be fully vaccinated, I hope by at least December for those holidays. Thanksgiving, it's a little too tight for that. But so vaccination, I think, is number one. And partly because there's usually a wide range of ages and types of work people do and types of places people live and medical conditions when you get together for a holiday. So there are people who are at high risk and there are people who are not at high risk for COVID. So you may have an asymptomatic younger person who's vaccinated, and then an older person, if they're not vaccinated, they could get it. And, I'm sure the family does not want to have that type of situation for their holidays. So, I think as long as everybody is vaccinated, it can be a nice time to gather this year. I think it's a little harder for families who have someone who's really immunocompromised. And so I think that decision-making, they may do more masking or more distancing, when they gather. But, I think with the vaccination and the kids 5 and older, hopefully also getting to the point where they're vaccinated, there can be more opportunity for gathering than maybe in previous years with COVID.
And maybe one more holiday season where we don't have office holiday parties?
Yes. And I think there are some offices that have really also moved towards full vaccination. And of course, that would make it a bit easier, but still very large gatherings. It's still pretty likely that somebody in that gathering will have COVID and be able to pass it. Even if every single person was vaccinated, let's say I get it from someone in a large gathering, I could go home and pass it to someone who is more immunocompromised or more at risk than I am. And so I think that's one of the difficulties with very large gatherings. It's just much more likely that somebody there will maybe be asymptomatic and be able to pass COVID to someone else who will be asymptomatic, but then it gets passed on to somebody eventually that will succumb to it.
So the Cliff Notes is get vaccinated,
Yeah,
continue to sanitize,
yes,
and wear masks when needed.
yes. And I think in public places, in large gatherings, masks is still very important. We've definitely seen, especially in other countries as well, when people take the masks off, the rates of COVID go way up. We've seen that in schools as well. Schools that are very careful about masking, sanitizing, distancing. We do not see COVID there, but we do in places that are not masked. So that's definitely something that we can learn from, I think.
Dr. Zandra Kelley, Chief Medical Officer at Greater Lawrence Family Health Center. It's always a pleasure. And maybe someday we'll be talking about happier, healthier things.
Something other than COVID. Yes, maybe.
Something other than COVID. Yes. Thanks so much for joining me, Doc.
Appreciate it. Thank you.